project. Some are also Japanese-funded projects or Global Affairs, a Canadian government-funded project. So I have implemented a wide range of projects in Nigeria, including highest burden states where we have maternal death and poor child survival in 6 states of northern Nigeria. I've also implemented projects funded by UNHCR in the refugee camp in Cross River State and also in Benue State in Nigeria. So in a nutshell, this is just a summary of the work that I have done across the country at national and the international level, but all within the health sector, though I have also had little experience of work in the education sector, in the humanitarian crisis.
Okay, well, that certainly does help putting you in perspective. So where did you have time for politics in all of this? I mean, here you are, special advisor to the president. So how did that come about?
So it's really interesting because as a result of the work I did in one of the projects I implemented, which is one of the largest flagship projects in Africa, improving maternal and child health in 6 states of northern Nigeria, funded by the UK government. I came very closely with policymakers and then I realized that without bridging the gaps between us, technocrats, and politicians, we are not going to achieve success. Because the politicians need to understand why we need to improve health, why we need to have adequate budgetary allocation, and in a sustained manner for us to realize that. So the work I did in Kano, in Yobe State, in Zamfara, in Jigawa State, you know, it shows that as a politician, when you convince them, they do a lot of role, they play a lot of influence, they influence the governors to dedicate resources. And these are states where we've been able to establish the state contributory health scheme, the drug revolving fund scheme, which is still sustained and they are ongoing. In fact, in one of the states, working with other partners and politicians, we're able to set up the first Kano State Trust Fund, you know, that supports vulnerable people. So, and the experience of working also as Commissioner of Health in my state brought me very close to politicians. And we realized we're able to do quite a lot of things and get things done, despite the humanitarian crisis as of that time, because that was the peak of the crisis. And so a lot, when I came back to the ministry, I was able to push and ensure that we also have a health sector response to the humanitarian crisis that led to even the Northeast Development Commission and the Ministry of Humanitarian Crisis. So I thought, why don't I try politics? And you can't believe it, Folari, I contested for the position of the senator in my constituency, Southern Borno, in 2019. And it was a lot of learning, a lot of success for me, and a huge curve that I have learned so much that as a politician, we can make a lot of impact. So that was the beginning of it. So we are now talking about this administration. When this administration pre-election came, President Bola Ahmed Tinubu indicated interest. And we said, we together came together with some concerned citizens. And I must mention Dr. Jide Idris, whom we felt that we must do something differently. We must be able to set an agenda that will be sustained in this country. So we tried to start working on the agenda, meeting with stakeholders to identify what are the problems. And this was also presented to the president, who also have his own agenda of what he wants to achieve. So based on his agenda, we worked on it and did a lot of pre-election stakeholder engagement. I was anchoring the northern Nigeria. And you know the health industry is so large. All the categories of health workers were covered. They're so large. All diverse, up to the level of the hospital attendants. So we mobilized coordinators and then came together and did a lot of engagements with them and came up with an agenda based on what the president wants to achieve. What are the challenges? How do we overcome? What are the strengths that exist that we wanted to continue? This was presented to him, and he was very happy about it, and because it aligned fully with his aspirations and campaign promises. So after the election, we were able to come together again under the president, the Presidential Advisory Committee on to the president. Health sector is part of it. And president is very concerned about the health sector because he is someone that believes that without adequate health, you cannot achieve meaningful development. So I was appointed to chair the Presidential Advisory Committee subcommittee on health, which we developed the policy document around his 8 campaign promises. And I may just quickly mention those campaign promises because those should be the areas that president wants to ensure that he delivers to Nigerians by 2027. And I strongly believe that he's still on track and committed to those commitments. So first, it's around issues of governance, you know, right from who do we appoint to lead the health sector. And then how do we address social determinants of health? So all those have to be brought together under one effective coordination system in the health sector to avoid fragmentation, duplication, and silos, implementation of activities in the country which does not yield to meaningful effect in terms of impact. So those were areas around leadership, coordination, and even reviewing the institutional arrangement in the health sector. That was of concern to President Bola Ahmed Tinubu. And then he looked at also the area of financing, because he is committed and he has realized the huge funding gaps in funding. Of course, we realize that government cannot do the funding alone, but we need to mobilize and ensure that we harmonize all resources together so that we have maximum effect of funding. And government must demonstrate highest level of commitment to increase funding for the health sector, not only at the national but also at subnational level. Human resources was a huge issue, which has always been there for years in Nigeria, but it became worse, with the advent of the COVID pandemic. And that was an area President also indicated in area of interest. How do we increase production of human resources for health across board, and also retain them and create enabling environment for our health workers to ensure that they provide quality healthcare services to all Nigerians, irrespective of where they come from, or whatever their social affiliations and cultural backgrounds are. The third that was so dear to Mr. President was about local manufacture. President Bola Ahmed Tinubu is very concerned that we must produce our medicines, we must produce our drugs, we must produce our our medical equipments, including commodities. They are all doable in Nigeria. So he is concerned about how do we transfer technology to Nigeria, how do we explore and create enabling environment for potential manufacturers so that they can produce in Nigeria to reduce the cost of our commodities, medical commodities and drugs in Nigeria, and possibly also to export to other countries. So those are areas, and he has matched those areas. And then the other area that he has also is about the pandemic, the public health security, which we put them under public health security, building a strong resilience systems that will prevent that. Then we also looked at area of his concern, its delivery of quality health care to populations of Nigeria, with focus on the vulnerable people. And when I talk about vulnerable people, we're talking also about women, children, the elderly people, including people with disabilities. Those are areas of concern for President Bola Ahmed Tinubu, and he made promises around those areas, which has to do with integrated healthcare delivery services across, from the primary healthcare level, secondary level at the state, and also tertiary institutions that are manned by the federal government of Nigeria. So a lot was done, but I must also add the last two, which are specifically around areas of information management, data generation, because whatever we do in terms of policy formulations and practices, they must be guided by evidence. They must be evidence-based, based on data we have generated. What has worked, what has not worked. How can we improve in what we are doing? So data management, digitalization, and use of modern technology is a key component of this administration, so that we should be guided based on evidence of what we do, and also research is a part of it. So lastly, I must mention is about partnership. Partnership, as I mentioned earlier, government cannot do it alone. We must form a formidable partnership around the health sector and maximize the effect of all resources and align in line with the vision and priorities of President Bola Ahmed Tinubu. So those are the 8 priority areas of Mr. President. And those are areas that he canvassed and we campaigned for pre-elections. And after election, there were the areas that were fully articulated. And President remained committed on those areas, and he's delivering. We are just 14 months old in the administration. But I can tell you, Folari, I can pick each one of them, and I can tell you President has made progress within the 14 months, because we have a tracker. We have the first 100 days in office, which was 100% accomplished. We have 12 to 18 months, and we are 14 months today. And then we have after 18 months to the 4 years by 2027. So in each of these aspects, programs have made progress in the aspect at his own level and at the level of implementation. That is by the Federal Ministry of Health and its parastatals, led by the coordinating Minister of Health, and
exactly.
At subnational level.
Because where you've just landed is what I was going to ask about. How do you interface with the coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate? Because it was a very comprehensive overview that you gave us. And so at one time, he is minister, and then you are advisor to the president. Are there areas of overlap or clashes, or how does it work? A lot of us outside don't know really how it works between special advisors like your good self and the minister who is the head of the ministry.
So let me put it this way first so that we understand the background. This is the very first time that Nigeria is witnessing a position of special advisor on health, which was deliberately and intentionally created by President Bola Ahmed Tinubu because of his passion for health. He doesn't want to leave any gaps, and then he wants to ensure that the campaign promises are realized based on the policy document that he has endorsed. So, and he has implemented that. So at my level as a special advisor of health is to support the president and also support the Honorable Minister of Health, operationalize and realize the intention of President Bola Ahmed Tinubu. So Professor Pate is not a new person to me. We've been together for a very long time, and then we have been at one level, worked together. When I was Commissioner of Health, he was the State Minister of Health. When he was in the National Primary Healthcare Development Agency as ED, I was Assistant Rep at UNFPA country level. So we work together and complement the efforts of each other. And interestingly, before his appointment, because what led even to the appointment of the coordinator is part of the issues we have raised in our document, that there is need not just to address, because health does not stand alone as a standalone entity. Health is it's all affected by all other sectors of development, and also there are social determinants. So we are happy that the president appointed a coordinating minister of health, and also add upon that health sector the social welfare aspect of it, which is very critical and important. So this is progress that have been made in the development of Nigeria, because you look at the totality of health, not as a standalone entity, but also affected by other sectors and entities of social development. So when the minister came, even before he came, we have been discussing the issues, and he has also made significant contributions on the policy documents. And so when he came also, and luckily also the Minister of State was a member of the Presidential Advising Committee on PAC, which of that small committee that I was chairing, Dr. Alausa. So we all work together, and he's also very conversant on all the issues that were developed around that. So we made a presentation and engaged with them closely with Professor Pate, which he also accepted and agreed that this is the way to go. Of course, he was part of it. So when he came, I'm very happy he was able to articulate all this, because the most important thing in Nigeria is how do we implement? You know, it's not about the policy document, but it's about realization of the policy document. So in his own wisdom, he was able to come with a modalities and implementation approach, you know, around 4-point agenda, you know, which summarizes the priority areas of Mr. President. He was talking about the population and health, you know, delivery of services, inclusive of it, including maternal and child health services, and preventive and...
Good morning, Uncle Yori, and good morning to the special advisor. Uncle Yori, thank you very much for bringing in this lady. I'm really thrilled, and I'm surprised that there is somebody like this in President Bola Ahmed Tinubu's government. She has all the information at her fingertips, even on matters that are not related to the health ministry. Uncle Yori, I have been always, you know that I've always been talking about this government not having spokespersons that can market what they are doing. I think this woman is in a better position if such a person is needed to express what the government is doing to the people. I'm not seeing her looking at any paper. She has all the information at her fingertips. This is the kind of person that the government needs to speak for it. I commend you, madam, and I wish you strength. But I have one question, madam. The question relates to the NHIS. The former president, President Buhari, voted money to that scheme. And towards the end of his administration, we were told that the money that was voted got mismanaged, and we don't know what the security agencies did with it. As important as that insurance health scheme for the people, what is the government of today doing about it to ensure that that program gets to the people? Thank you for what you are doing.
Thank you for calling in and the question. Okay, Dr. Selma.
All right, thank you. So let me jump on that. Thank you so much for the encouragement and the support. So let me say categorically, I have been in that system, and I am not aware of money that has been mismanaged. But what I can say, the repositioning and the restructuring of the NHIA in Nigeria, which we used to call the National Health Insurance Scheme, happened during the time of Buhari's administration. It was during Buhari's administration that it was fully repositioned, and it was made mandatory that every Nigerian must have access to insurance at the national and subnational level. It was during that time that we realized that every state government must also establish a contributory health insurance scheme, depending on how they want to call it, but there must be an current insurance coverage. Then I must also mention some of the great achievements which we have sustained under the leadership of President Bola Ahmed Tinubu, is also the basic healthcare funding. That is where 1% of the Consolidated Revenue Fund, which is part of the National Health Act agreement, must be dedicated, you know, to strengthen the health system, specifically primary healthcare system, and access to services for vulnerable people. This was operationalized during the time of President Buhari in 2018. That was the first time it started, between 2018 to 20. So funds were allocated to the National Health Insurance Authority for procurement of services for vulnerable people. And then part of that fund also, about 45% of it also was allocated to the National Primary Healthcare Development Agencies to strengthen the primary healthcare system at the subnational level. So this all happened. So when President Bola Ahmed Tinubu came, you know, part of what President Bola Ahmed Tinubu did was to continue with existing efforts that are adding value to the health system. And two, identify all gaps that I have mentioned and work on those gaps to bridge those gaps and address the issues as quickly as possible. And then thirdly, to also bring new innovations that will improve on delivery of healthcare services in Nigeria. So those were the cardinal approach that the president adopted and want to address in Nigeria. So part of the quick wins was to pick and expand the insurance coverage under the National Health Insurance, because he wanted to achieve 50 million vulnerable Nigerians on that services. And from what we were doing in the past was grossly inadequate. There's no way we can achieve that. So as soon as President Bola Ahmed Tinubu came on board, he expanded the coverage of the National Health Insurance Scheme, which is the mandatory scheme, and you can access it either at the primary level, wherever you want, and also the private sector also is still ongoing. So this happened at the national level, and also continuous advocacy and lobbying with state governors also to do similar, because it's not enough. And this funding is coming from the basic healthcare funding. In addition to that, for the first time also in the country, President Bola Ahmed Tinubu approved the Vulnerable Group Fund, which is in our budget of 2024, to also improve and also be a catalytic funding in addition to the BHCS funding, because even the BHCS funding is not enough to provide 100% coverage. And this is in line with his commitment for Nigeria to attain universal healthcare coverage, leaving no one behind. And when we say no one behind, of course, they are the vulnerable people that I talked about: women, children, adolescents, elderly people, and people with disabilities, and the poorest of the poor people in our communities. So this has been
Dr. Salma, I'm going to come back to you, and indeed you will continue on that, because I was going to ask questions about primary health care, because all of this, you probably will be reaching the most people through the primary health care system, or at least you should. Yeah. And here we are, Nigeria is experiencing a chronic shortage of health professionals, doctors, nurses, specialists, and the like, as a result of brain drain. So I'm going to take a break now. When we come back, we'll resume this conversation, and how you are, I'll get your assessment of how we're doing in the light of all that you have said, and the fact that it's an inescapable fact, we are suffering a brain drain of doctors, nurses, specialists, and the like. Please stay with us. We'll be right back, and we'll continue to take your calls for Dr. Salma Anas, Special Advisor to the President on Health.
Every major news story is with many perspectives and layered with different levels of impact.
Hello. What time did this happen? We will be right there.
At TVC News, we follow the big and major news, gathering the facts, witnessing the outcome.
I am here live at the aftermath of the approval of the new national minimum wage.
We are TV Station of the Year, not just for breaking news, but for being first, fair and accurate. TVC News, first with breaking news.
Okay, welcome back. Our guest still is Dr. Salma Anas, Special Advisor to President Tinubu on health. And just as we were leaving, I was bringing up the matter about the twin facts of, one, you want to expand your infrastructure, your health infrastructure, especially as it relates to primary health care centers, and the fact that we have a chronic shortage, and it doesn't seem to be reducing, of the key professionals in that sector. How does this impact all those things that you've been talking about and President Tinubu's plans, especially campaign plans, and some of them you said since arriving in office he has actually initiated? How does this shortage of these core professionals affect your vision for the health sector?
Thank you so much. So it's interesting also to say that President Bola Ahmed Tinubu is an individual who understood exactly what he wanted to achieve. So it's not that he came and made the problems in office. As I told you, we did a lot of critical gap analysis, and he's very aware of the challenges in Nigeria, and he's ready to address them. And that's why he has the policy document ready within the first 3 months of his administration. And human resources gaps is one of the major areas to be addressed. So we want to deliver services. We want to strengthen and expand services. Of course, that has to be delivered by human beings. And those are the human resources for health, especially at the primary health care. And we're confronted with what we call the Japan syndrome, which is very rampant. And it cut across not only medical doctors, but including even auxiliary nurses and midwives at the lowest level. So what we are doing currently is a multiple-pronged approach. It's not one approach, because it's like you are in a war zone. I'm from Borno State. I've delivered services in the midst of humanitarian crisis. So you can't say until you finish this before you start this. So everything will happen at the same time. We are strengthening the system. We are doing infrastructural upgrade. We are moving from 1 primary healthcare facilities to 2 primary healthcare facilities per ward. And that is huge responsibilities and resources required. And at the same time, we are struggling with human resources. So part of the immediate measures was to build capacities of the frontline health workers and to attract more health workers as volunteers to build their capacities. And this is currently ongoing by the Federal Ministry of Health. And then also increase production. We must increase, because we are producing grossly inadequate human resources for health. Let me give you an example. If you said we've not even met the standard of WHO, what we have today is 1 doctor to about 400. That is the standard of WHO. But we have over 6,000. 1 doctor seeing about 6,000 and above patients or clients, which is grossly, the person cannot cope. He'll be overburdened, he'll be stressed up. So what we are doing is, first of all, increase the production of healthcare providers. And these efforts, immediately we jump-started on it. The School of Nursing and Midwifery, under the National Council of Nursing and Midwifery Council of Nigeria, they've already started that. They've already expanded production of nurses. Now you go to our tertiary institutions where they are producing maximum between 50 to 100 nurses per annum. It's so low. Now they've increased their production to about 250,000, and at the same time increasing infrastructure and upgrade, and also bringing on board human resources that will do the tutelage and mentorship. So this is happening, and also we've gone beyond government public sector, institutions. We are opening up and attracting private sectors. So if you go to School of Nursing, I'm using the nursing as a benchmark. You go to the School of Nursing and Midwifery Council, you will find that a lot of private sectors have been accredited that have made the standard requirement for training of nurses and midwives, including training of community health workers, community health extension workers, junior health workers, including volunteers. So all these efforts are happening at the same time. So if you look at the record, a lot we have moved in terms of production, and now setting up also training institutions by the private sectors to also come in and support. Another area is, of course, how do we retain them? It's also very important. There is no law that says you must stay in your country to practice. But of course, we encourage them to stay by creating enabling environment, by providing the tools for them to work with so that they feel satisfied. And government is also looking into their welfare in terms of their remuneration, in terms of addressing some of the conflicts within the professionalism and then the systems of how we work and operate in the country. Multiple approach that we have adopted to address those issues so that we achieve quick wins in terms of how do we deliver results to Nigerians. Okay. And I'm glad to mention...
Let me come in. I beg your pardon, Dr. Sama. I beg your pardon, Dr. Sama. Let me bring on Mohammed, who has called in from Abuja. Good morning, Mr. Mohammed in Abuja.
Good morning, Uncle Yori.
Good morning, sir. Thank you for calling in.
Good morning, Doctor. I really appreciate you very much.
Very well, but it's not your fault.
I'm surprised we have people like this in the country. This is exactly the woman that's supposed to be the minister. She's vocal, she's educated, she's well-informed, she's well-versed, and the policies she has rolled out now, those are the policies that we were supposed to be informed. The way this guy from Lagos Paul, she's supposed to be telling Nigeria all those policies, and then Nigerians should see all those policies. But the implementation, that is the problem. Always we have good policies, but to implement it, that is our problem in Nigeria. So I hope she will work with the minister and then make sure those policies are implemented to the latter. But definitely, those are the good policies. And then the issue of NHIS, please, we need government to work on that NHIS too. Because most of the hospitals, if you have a treatment more than 10,000, they will say you have to pay. Some of them, but I don't know some, but most of the ones we are patronizing, some of them, anything above 10,000, 20,000, they will say you have to pay for. What is the rationale behind that? I want her to explain those issues. Thank you, and then have a nice day. Thank you.
Thank you very much, Mohammed. I appreciate also what you have said. But, you know, we all have a role to play and contribute. You don't have to be in either a ministerial position, but you can make your own meaningful contribution. And I work assiduously behind the scene to ensure that President Bola Ahmed Tinubu realized those campaign promises. And I'm strongly convinced it is doable with the people that he has assembled to lead on that. So, yeah, on NHIA, you know, Nigeria, we are caught up at the same time in an economic crisis, which means we have to shift, we have to also do things differently. But of course, we are not relenting in our efforts to ensure that Nigerians have access to medical services. So if you are buying paracetamol at, let's say, 5 naira before, now it has changed due to the situation we found ourselves. But of course, we brought in a lot of policies, as I have said, which are not going to yield results immediately. One of which is about the local manufacture and boosting companies that are doing. Nigerians are producing some drugs, but we need to also enhance them. And this is what President Bola Ahmed Tinubu is doing. Encourage them, provide the enabling environment. And then we're going to see the outcome of it very soon in terms of that. So you find out a lot of escalation and changes of pricing, even with the NHIA. But they are working towards it, and they've reviewed some of how much should be paid, what should be the contributions, and a lot of efforts are going on to see that we also correct all those anomalies that are happening within our health sector. And at the same time we are also trying to make our health to be more responsible in terms of transparency and accountability. Thank you.
Sorry to butt in. I was even reading that it's the president's interest for us to manufacture as much of the medical equipment as we can, even whatever the level of that. In this connection, I understand that there's a drive for us to manufacture our own syringes locally, but probably there's more that you can add. So there's that. Okay, let me bring...
Definitely. I just want to mention that, and a president has matched that with order. He has passed an executive order recently, which includes ban on tariff, you know, and even taxation on pharmaceutical importation of pharmaceutical products, even the raw materials, to encourage local manufacturers, including the active pharmaceutical ingredients, for the next 6 months. So he has removed all that tax on importation and tariffs. And these are part of the enabling environment that he has created. So that's why I say, if I take each one, you can see the president has made his commitment. And he's working towards matching and realization of those commitments. And with all those, it will come to a fruition very soon, once our local manufacturers, especially as you mentioned, the syringes. We've banned also importation of plastic syringes in the country.
Indeed. Let me bring on Chidi. Chidi has called in from Kafanchan. Good morning, Mr. Chidi.
Good morning, Uncle Yori.
Thank you for calling in.
Good morning, Dr. Samatu. Yes, I want to appreciate her for her superior analytical prowess, which she has been dishing out concerning the medical health sector. But I feel agitated to ask, Madam Doctor, please, what and how you are working synergically with the incumbent Minister of Health in order to ensure an adequate provision of healthcare delivery to every average Nigerian, to mitigate in the area of medical tourism and the Japa syndrome in our health workers? That is my own candid question. Otherwise, I appreciate all you have been saying, and I say congratulations to you, man.
Thank you.
Thank you very much, Uncle Yori, for allowing me.
Thank you very much, Mr. Chidi, calling in from Kafanchan. Dr. Sama?
Yes, so thank you. Of course, medical tourism is a challenge, and I can share with you, I was opportune to head Hospital Services Department of the Federal Ministry of Health just before my recent appointment. And we were very worried about medical tourism, and we did a little research, rapid assessment, to find out why do Nigerians even seek services abroad, despite the fact that we know the most talented and well-resourced medical personnel are from Nigerians in whichever country you go globally, either Canada, the developed country, UK, US, or you go to the Middle East, or you go to India, or any other one. You find Nigerians there. A lot of people have come to say they met Nigerians there, and it was a Nigerian doctor that treated them. So part of what came out of that analysis is not lack of talented medical doctors in Nigeria. What came out on top was the nursing care. A lot of them said that, oh, you have a great nursing care, the nurses are humble, the nurses will take care of you, you have a nurse attached to you and all that. That's okay. We say, okay, let's look at it. We didn't deny that finding. And we say, let's see how we can address attitudes of our health workers. But of course, also issues of workload. And then what also came out, where do they go? Most of them go for specialized care, like cardiology, heart problems, if I may put it that way in a layman, kidney problems, and then problems, neurological problems or brain problems and spinal problems, and then orthopedic. So those are the main things, and we all have those specialists here in Nigeria. But of course, we acknowledge also there are gaps in terms of modern technology available. And these are part of the upgrade that President Bola Ahmed Tinubu is committed. And they've started, including, I already mentioned, cancer care, management of cancer. So those are the areas that he's doing. And we continued, as I said earlier, with what was working, like in cancer care. We've already started a program under Buhari's administration where funds was allocated, which we call the Cancer Fund, in some dedicated tertiary institutions. And it's running well in partnership with private sector. And then upgrade of our tertiary institution with radio diagnostic and radiotherapy equipment, modern ones. And today, if you go to some of the teaching hospitals like UMTH, you go to ECH Ibadan, you will see all those modern technologies there. And some of them in the pipeline, which we have continued in this administration. And they've signed an agreement with NSITF to continue to ensure that we upgrade tertiary institutions that will provide state-of-the-art radiotherapy equipment. So all these are going on. And this we hope when they are available, it will track. Yeah.
Okay. So sorry, I've got to come in again. There's another caller on the line.
Yes. All right.
Hello.
Hello, Ada in Jos.
Hello, Yori.
Good morning, Ada in Jos.
Good morning. I've kept you for too long. Good morning to your guests there. Yes, I hear your guests, all the things she's trying to explain. There's a lot of problem with our health facilities, you know. But one thing I want to point out to you again, the way we treat our doctors here, people in the health, especially medical doctors, a house officer, that is the first time government is engaging a house officer. Go and find out what I'm telling you now. They get them engaged as far as April. By 4 months, 5 months, 6 months, they don't get paid. At that stage, you're just preparing their mind to japa. Please, madam, please, I'm begging you to please tell the president or the person who's in charge, whoever is concerned, let them look into it. It's not fair. I even asked other house officers. They said it has been like that. It has been happening for more than 2 decades. They engage them. They say it's bureaucratic, whatever. What is the bureaucracy there? Don't the government know that they're going to engage them? And they overwork them because they don't have the ratio is so small. Most of the doctors have left. They make use of the coppers and the house officers, and then they don't get paid. Is it then you're saying they are Japan? Why won't they Japan?
Okay, Ada. Okay, Ada.
That's all I have to say for this morning. All the things. Because
let's give Dr. Salma a chance to respond to that.
Yeah,
okay,
I agree with you, Ada. It is indeed very sad. And this is part of the weaknesses in our managerial systems and leadership at the hospital level. So what we have found is what we felt we need to improve the performance in terms of management of our hospitals and leadership. So it's not just for you to be a medical doctor and maybe a consultant for you to head an institution. You must also have leadership skills. And this we have instituted even when I was heading our hospital to say that you must score significantly in your leadership skills and the trainings you've had, and also in your managerial skills. And also in our systems, let me say, they are tertiary institutions. It's under the office also of the head of service of the federation. So for them to recruit and to be placed on the IPPIS system, which is, of course, I support that, you know, it gives us transparency in terms of avoiding use of ghost workers. So it takes time, but I agree with you. We need to facilitate and tidy up and connect and ensure that life-saving, anything that has to do with life, including the inputs by our house officers, is very significant. And we will ensure that we tidy up that. And this administration, when they came, they've made efforts towards doing that and given even a waiver.
I'm so sorry, Dr. Salma. I've got to come in again. Elder David has called in from Alimosho. He also wants to make a contribution. Good morning, Hello. Elder David. Go ahead, Elder David.
Good morning, Sir Yori.
Thank you very much for calling in. Good morning.
Thank you very much. Thank you very much. And I thank the doctor that he is even explaining things to us there. And may God bless her too, because what he's explaining to us, I quite agree with him, because there must be a change. This government have just come in. Let us be patient with them. Let us not be making reference to the past, because the problem you are seeing today did not start now. It started a long time ago. And that is why they are now correcting it. If this government reach a year or 2 years' time, Nigerians themselves, we thank God that we have somebody in government today that God have ordained to correct it. And may God bless Buhari, the hero of democracy, one of the best in 1999. He started most of those projects. We know what he did. There is no lie about him, not playing politics. From 1999 to 2015, we were in a coma. We have problems. All the problem the credit is what you are talking about. The medical department, they are the people God himself is using to cure people. If I'm to pay my taxes, I will pay to medical, because I respect the doctors and nurses. God use them. They say God cure, doctors take the credit for it.
All right then. Thank you very much, Elder David. Elder David, I beg your pardon. Thank you very much for calling in. Now, I did want to spend the last moments of our program, and it's astounding how the time has flown since we started. That's because Dr. Salma Anas makes it also very interesting and comprehensive. I wanted to return as we go to the issue of the area of greatest need, whereas all the specialists are fine, but in those rural areas, that's where impact is required to be felt. All the poor people. Now, you've explained to us efforts in that direction, but all of this costs money. Equipping those hospitals so that they are little more than shacks or shanties, as has been the case in the past. Let me add an adjunct to that question, because we were talking about the excellence of Nigerian medical personnel. the elite in this society don't seem to back you up. As you know, oftentimes we hear that all the elite are looking for medical attention or help abroad. Is that a problem? And what is it that leads to that? Because we might not have enough, but certainly we do have the excellence that you have indicated.
So yes, I just in line with what you have said, we may not have a lot, but it's a choice that they make, not because we lack talents in Nigeria and medical doctors that could do the job in Nigeria, but it's a choice for those that can afford to go abroad. But let me tell you, for most Nigerians, significantly, there are just very few that travel abroad. And I want to take our minds back to the COVID era. We were locked down in this country because of the COVID. No one was traveling for almost 3 years. So I was in hospital service, heading the Department of Hospital Service. I said, let's do a quick analysis. Have our mortality increased in Nigeria because people are not going abroad? Nothing increased. In fact, we had increased patients that we are seeing in our hospitals, at our tertiary institutions, and our secondary level of care. Our death has not increased if you reduce death associated with the COVID-19. So it's a choice. They decide because they have so much money and they want to go abroad. Just like I'm a Muslim, a lot of people decide they want to go for Umrah, even though when they have a lot of people around their communities that cannot even feed themselves, which I personally feel you can do that and even earn better reward. So it's a choice. But this administration of President Bola Ahmed Tinubu, as he is committed, is to see that he meets those that are in most need of services. And majority of Nigerians, I can tell you, over 70% are in need of services. And those are the vulnerable people. And that's why he's focusing on strengthening our primary healthcare facilities, capacity building our health workers, strengthening those with basic equipment, ensuring that we have local manufacture. Most importantly, also, to reduce the deaths that occur as a result of pregnancy and childbirth and related causes and improve survival. As we are today, Nigeria has one of the highest maternal deaths. We cannot reverse our statistics without ensuring that primary health care are functioning. And part of what I do as an advisor to the president, I am not an implementer. I advise and I support and I go to the sub-national level because that is the crux of the matter. Because the cross-national, the sub-national level, the governors, the policy makers, the stakeholders there must take responsibility and must take ownership because they are responsible for the citizens of their state. So I have been engaging at that level, and I'm happy that the governors that we have there are very open and are very flexible and are very ready to align with the vision and priorities of President Bola Ahmed Tinubu. And I believe together
we're going to have to leave it there. We're going to have to leave it there. Regrettably, we're going to have to leave it there because this is also very enlightening, and we thank you for being as forthright and forthcoming as you are. As you heard some people say, there's a lot that they're finding out that they weren't even aware of. In fact, it strikes me that we need to invite you back again because there are so many areas that we haven't touched that I can imagine would be of special interest to you. Maternal health, female health in particular, that whole area, even the matter of nutrition, because that feeds very much into doctors want you to, they say we are what we eat. So unfortunately, in Nigeria today, people can't eat as well as doctors want them to be able to. That's a whole different subject matter altogether. But let me just thank you, Dr. Salma Anna, Special Advisor to the President on Health, for coming on our program this morning. Thank you very much.
Thank you so much, and thank you for inviting me, and thank you, Nigerians.
Indeed. Okay, so that's our program today. Do please join us tomorrow for a fresh edition. I am Yori Folani. Bye-bye for now.
Experience like an MIP experience. Be a part of the biggest Movie in the Park edition yet as we celebrate our historic 10th edition on December 9, 2023 at the Muri Okunola Park, Victoria Island, Lagos. Experience a movie under the sky, an unforgettable after party, and a night with your favorite celebrities partying like you've never seen. Event begins at 5 p.m. and the movie starts at 7 p.m. Join the excitement. Sign up at www.tix.africa/MIP-Big 10. This event is proudly sponsored by Star Radler, D-Vibe, Desperado, Pepsi, MTN, 20 Stripe, TVC Communications, and Trace Ninja. Follow us on Twitter and Instagram at MIP Experience for more information.
The following is a paid presentation by ShopX TV. Do you struggle with having an active and healthy lifestyle due to your busy schedule? Do you find it difficult to make it to the gym? You want to improve your overall health, but don't know where and how to start? Medical experts agree that walking, running, and jogging are amongst the best ways to stay fit and enjoy a great active and healthy lifestyle. What if there was a convenient and affordable way to improve your health, improve your mood, and lose weight right in your own home? Introducing the SportX Digital Compact Treadmill, the compact foldable treadmill that makes being active and losing weight fast and easy. Just unfold it and walk, jog, or run while you watch your favorite programs on TV. And when you're done, just fold it and store it away. Now that's convenience. The secret is its advanced design that houses a 1-horsepower motor that is twice the size of most treadmills, packed into a nice compact unit, powering every step you take. You get the SportX Digital Compact Treadmill System complete with a rugged commercial-grade ultra-durable traction belt, large LCD multifunctional display that displays speed, time, distance, calories, and has 12 different exercise programs, as well as a magnetic safety key for added security.
The SportX treadmill has really helped me get back in shape after childbirth. I love it because it's compact and can fit anywhere in the house. And when I'm done, I fold and put it away. Easy peasy.
This is the best piece of equipment for people like me who want to stay active without leaving the home. I simply unfold it and use it while I watch my favorite program on TV.
Joining a gym can cost an absolute fortune, and you could be paying up to 490,000 Naira in annual gym fees. Get the SportX Compact Digital Treadmill to save the cost and work out of the convenience of your home. You would normally pay 500,000 Naira.